I'm Sabrina Noguera, and I'm a student at Fitchburg State University, and for my honors thesis, I investigated the pathology of the gut-brain axis in Parkinson's disease. Parkinson's disease is known to be the second most common neurodegenerative disease following Alzheimer's disease. By the year 2030, approximately 1.2 million individuals will be diagnosed with Parkinson's disease in the United States alone, which is more than the combined number of individuals experiencing multiple sclerosis, muscular dystrophy, and Lou Gehrig's disease, making the desire to uncover the enigma of the pathology of Parkinson's disease incredibly necessary. The prevalence rates as of 2020 indicate that 1 million people are diagnosed with Parkinson's disease, and the incidence rates rise with age, with about 4% of individuals being diagnosed with Parkinson's disease before the age of 50. In 1817, James Parkinson found what he coined as the shaking palsy, which is now referred to as Parkinson's disease. The symptoms include tremors, rigid movements, gastrointestinal issues, cognitive deficits, and minimized facial expressions, along with a host of many others. Recent research has suggested that the symptoms, mainly gastrointestinal symptoms in nature, precede a diagnosis by 20 years. There are many risk and protective factors with Parkinson's disease, just as there are with many other diseases. So the risk factors that have been found for Parkinson's disease include rural living, well drinking water, farming, exposure to herbicides, insecticides, and pesticides, as well as heavy metal exposure. Some protective factors, on the other hand, include smoking, caffeine, female hormones, and exercise. Now, the brain of a Parkinson's patient is definitely different from that of a healthy brain, especially in one area, which is the substantia nigra pars compacta. In this image below, you see the healthy brain, and if we move over to the right, we can then see a very healthy substantia nigra. And we know that this is healthy due to the deep and rich dark color of the substantia nigra, which means there are deeply and densely packed dopamine neurons in there. If you move over to the right again, we can see that this is healthy dopamine production. And then if we move down to the Parkinson's brain, we see that it is very pale and completely depigmented, which means that there has been a substantial loss of dopamine neurons in the substantia nigra. Moving over to the next side, you see that dopamine production is no longer healthy, and therefore the production of that dopamine is either going to be limited or completely obsolete in Parkinson's patients. We know that there are detrimental effects due to the loss of dopamine, but what does dopamine do and why is it important, especially in Parkinson's disease? Dopamine is an essential neurotransmitter that is responsible for the reward centers of the brain, memory, attention, and the regulation of body movements. Interestingly, dopaminergic neurons make up around 14 to 20% of the neurons that are located within the upper GI tract. It has also been found that motor symptoms appear once more than 80% of the dopamine neurons have died in the substantia nigra, therefore making dopamine a central feature within Parkinson's disease pathology. With 20% of the dopaminergic neurons being located in the upper GI tract and gastrointestinal symptoms such as drooling, dysphagia, delayed gastrointestinal emptying, and most commonly constipation, the microbiome is now called into question as the current research investigates the relationship between the gut and the microbiome. So the microbiome is considered to be the most diverse microbial community, consisting of a combination of bacteria, fungi, and viruses, which can all be heavily influenced by the environment, nutrients, hormones, genetics, and age. There's also been substantial evidence that associates the age of decline in the microbiome as being correlated to the age at which neurodegenerative diseases become apparent. In 2006, Brack and colleagues had hypothesized a phenomenon that is now referred to as the gut-brain axis, and they hypothesized that this was broken down into steps. So first, there would be aggregations of proteins that form in the microbiome. These aggregations would then be taken up through the dorsal motor route of the vagus nerve in an ascending manner to the brainstem, which then gets to higher regions of the brain And from there, we see the motor and cognitive symptoms that arise. As previously mentioned, Brack and colleagues had hypothesized that there were aggregations of proteins forming in the microbiome. This protein is alpha-synuclein, which is a presynaptic protein that is essential for synaptic transmission and is located on the vesicles of the presynaptic neuron. The true function of this protein is not fully understood and needs to be further investigated as the research does continue in order to make the effects of alpha-synuclein more clear in the pathology of this disease. Now, a hallmark of Parkinson's disease is Lewy bodies, and Lewy bodies actually contain aggregations of alpha-synuclein within their cytoplasm, which is then indicated that maybe it is these aggregations of alpha-synuclein which make the Lewy bodies toxic. There is much conflicting evidence concerning how alpha-synuclein is transported, although most research proposes that there is a prion-like mechanism that allows for alpha-synuclein to seed to neighboring neurons and therefore contribute to the neurodegenerative process. Here we have another image of alpha-synuclein from Delenclos and colleagues. And here we just see that alpha-synuclein begins as a monomer, then it forms into an oligomer, and then a fibril. And we see just that it begins with the aggregation, which leads to cellular dysfunction. That cellular dysfunction creates cytotoxicity, and that cytotoxicity will then ultimately lead to neurodegeneration. Accompanying the cytotoxic properties of alpha-synuclein is the process of inflammation, as it has been suggested that inflammation may have the ability to enhance and speed up the neurodegenerative process. Chronic infections have been researched to exacerbate inflammation, and Helicobacter pylori infection is one that is very prevalent in Parkinson's patients. And what this infection actually does is it inhibits the absorption of levodopa, which is a very popular medication taken by many Parkinson's patients. So while this is inhibiting the effects of it, it can either worsen or just leave the patient unsatisfied, as the symptoms will still persist and remain. There is also much evidence suggesting that inflammation has the ability to trigger alpha-synuclein aggregations. Parkinson's research also places an emphasis on the role of nutrients, as the food one consumes directly will then influence the microbiome. It has been found that vitamin A, D, and C have been correlated with elevated risks of Parkinson's disease, as well as high levels of iron and manganese, which have been shown to double the risk for developing Parkinson's disease. In an interesting study, it showed that dairy had been correlated with an increased risk, but it only showed that milk was associated with this and no other dairy, such as yogurt or cheese. Neuroprotective agents actually include berries, apples, oranges, red wine, and caffeine. There's also evidence that DHA protects against cytotoxicity and inhibits nitrogen oxide production, along with the reduction of apoptosis of dopaminergic neurons. Many diets have also been investigated, and the Mediterranean diet actually shows the most promise, whereas vegan, vegetarian, and hypoketogenic diets have shown potential protection, but there needs to be further research on it. It is important to note that this research is contradicting, and therefore strong correlations between specific nutrients and their impact on Parkinson's cannot be drawn at this time. There has also been much research on the environment and how it imposes on Parkinson's disease, although much of the research is divided just as with nutrients. So once again, exposure to pesticides, herbicides, insecticides, and heavy metals have shown potential relationships between exposure and the development of Parkinson's disease later on in life. But there are many limitations to all of this type of data collection, such as patient bias, unreliable memory recall, and over-reportings of exposure in hopes that they will find a cause to their disorder. Toxins can actually enter through the olfactory system and then have the ability to cross the blood-brain barrier, therefore affecting the brain and potentially contributing to the development of Parkinson's disease. Other exposures, such as rural living, well water drinking, metal, and woodwork, don't really have that much evidence to back it up, but there are still some studies that suggest correlations between them. There are many treatments for Parkinson's disease, such as medications including levodopa and invasive surgical procedures such as deep brain stimulation. Currently, there are 2 novel treatments that are under investigation, which are the fecal matter transplants as well as vagotomies. A fecal matter transplant is the implanting of fecal matter of a healthy subject into the GI tract of an individual who is experiencing Parkinson's disease. It was noted that after this procedure, there was a decline in gastrointestinal and non-gastrointestinal symptoms. There was also decreased levels of depression and anxiety. There was increased levels of sleep and a reduction in motor symptoms among patients. A vagotomy is the severing of the trunk of the vagus nerve from the gut, resulting in a reduced risk of developing Parkinson's disease by half, which is incredible. Now, what this does is it interrupts the spreading of alpha-synuclein from the microbiome to the brain via the vagus nerve. It was also found that full truncal vagotomies have shown to be protective against Parkinson's and aid in the reduction of symptoms. In conclusion, there is a substantial amount of evidence that correlates changes in the microbiome and how they impact the brain. Future research needs to continue to investigate these biological underpinnings of Parkinson's disease, and there is a need for further exploration between the links for inflammation, nutrients, and the environment on Parkinson's disease. There should also be further consideration for the bidirectional pathway of the gut-brain axis, which should be further researched. And here are all of my references. Thank you.